In this video, let's learn more about transarterial chemoembolization or TACE for treatment of liver cancer. So first things first, what is transarterial chemoembolization? Uses a technique of angiography in order to treat a liver cancer. So what is angiography? Angiography is divided into several types, and one of it is the catheter angiography. Okay, catheter angiography uses a catheter, X-ray imaging guidance, and an injection of contrast material in order to examine the blood vessels in the key areas of the body. So it produces a very detailed, clear, and accurate pictures of blood vessels. A thin plastic tube, or called as a catheter, is inserted into the skin or into the artery through a small incision in the skin. So once the catheter is guided to the area of the examine, a contrast material is injected through the tube and the images is captured using X-ray of small doses. The objective of TACE or transarterial chemoembolization is to shrink or upsize the tumor. It combines the local delivery of chemotherapy with a procedure called embolization in order to treat liver cancer. Embolization is the movement of a blood clot, a piece of tissue or a pocket of gas from where it forms through the bloodstream until it lodges in place, cutting off the flow of blood with its oxygen and nutrients, or in other words, it is defined as a minimally invasive treatment that blocks more than one blood vessels or abnormal vascular channels. It is a highly effective way to control bleeding as compared to an open surgery. In TACE, anti-cancer drugs are injected directly into the blood vessel, feeding a cancerous tumor. And plus, a synthetic material called the embolic agent is placed inside the blood vessels that supply the blood to the tumor, in effect to trap the chemotherapy or the drug in the tumor and block the blood flow to the tumor. So the patient that is potential enough to undergo transarterial chemoembolization is a patient that suffers from primary liver cancer, or we call it as hepatocellular carcinoma. Okay. TACE requires an X-ray equipment, a TV-like monitor called the fluoroscopy to convert X-ray into video images and to watch and guide the progress. Also, TACE requires catheter, which is a thin plastic tube of 1/8 inch in diameter, embolic agents in order to block off the blood vessels. The examples of embolic agents are oil and plastic particles made from PVA. Also, TACE requires IV line and also ultrasound machine. Transarterial chemoembolization or TACE works under the principle of delivering a very high concentration of chemotherapy or anti-cancer drugs directly into the tumor, and it also works under the principle of cutting off the blood supply to the tumor, trapping the anti-cancer drugs at the site. Therefore, it deprives the tumor from oxygen and nutrients. TACE steps are divided into three, which is the pre-TACE, the procedure, and the post-TACE. For pre-TACE, examine, review imaging from CT and MRI. Also, the review of lab tests is required. Also, the patient needs to obey the principle of no eating prior to the treatment. During the procedure, X-ray is taken to map out the path of the blood vessels feeding the tumor. And then IV line is started, and a small puncture in the groin artery is placed and travel up with a small tube or the catheter to the liver. The images of the arteries is produced by injecting a contrast agent. Usually we use iodine. A see-through real-time X-ray machine called the fluoroscopy is used to guide the process. The fluoroscopy is used to map out the arteries and tumor size and to determine which blood vessel actually supply the tumor. When it is confirmed, the doctor will deliver a chemoembolic agent, which are usually cisplatin and dextromethorphan. And then after the treatment, no, after the process, the close-up of the artery is done using closure device, which is a small metal tip that will stay permanently inside. Okay, moving on to the post TACE procedure, the patient needs to keep the leg straight for at least 2 hours when the small metal chip is inserted, or if not, if there is no closing chip closure device, 6 hours is needed for the patient to actually keep the leg straight. Okay, the side effect of TACE procedure is post-embolization syndrome, which consists of pain, nausea, vomiting, fever, fatigue, and poor appetite. Follow-up after TACE treatment, CT and MRI scan is needed after the procedure in order to evaluate the effects of the chemo agents to see the tumor size. Also, the benefits of TACE, it stops the liver tumors from growing. Usually, TACE treatment lasts for 10 to 14 months depending on the type of the tumor. TACE can also combine with other types of therapy. Examples are radiation and tumor ablation. Also, the benefit of TACE is it preserves the liver function and physiology. The risk of TACE consists of infection, allergic reaction to contrast material because angiography is the part of the procedure, and also there is a chance of having kidney damage due to the contrast agent.